All right, so in this video, we're going to talk about mobilizing sphenoid, which is this pink bone right here, externally. Okay, there's an option to mobilize sphenoid inside the mouth, as you can see the pink bone here, but externally you can mobilize here. Now, externally, typically if we're mobilizing that, it is more of a shear is the intention. Internally, the intention is more of a rotational intention. Okay, you could do a little side bending as well internally, but shearing specifically is what you're working on whenever you're working externally. Now, when I'm assessing this on the table, I'll start in this kind of hook-lying position. I will sink into basically their temples, and I will see if I sink and spring into that sphenoid, does it have a hard infill? Versus the left side, if I sink and spring, does it have a hard infill? Okay, this can be a little bit tricky because there's soft tissue to sink through here in temporalis. And just fascially, there's a decent amount of fascia in this area. So you could feel like it is positionally to one side, but your spring test is going to guide which direction you're going to work on shear, okay? And it's very possible with this bone, you could actually work on both. They could both have a hard infill, okay? So with Kelsey, oh, I should show you this also real quick. So the actual mobilization is to then go on whatever side up that you're interested in mobilizing, and then you actually sink into that sphenoid as you then localize through little head motions or motions throughout the rest of the body, which we will go over. But essentially we're blocking the rest of the cranium with the half foam roll so that we can relatively mobilize through sphenoid. All right, so now, yep, you're just going to slide over. That's good. There. And I am going to find her temples, basically, the easiest way to say. And then I sink through that soft tissue. I could sit and do some soft tissue work because there is some work to be done. And then if I spring test the left side, left to right, that feels springy to me. If I sink in on the right side and spring test towards the left, that feels hard to me. Was I right? Mm-hmm. Okay. Sarah, who's filming, was like, do you want to see if you can figure it out? I knew that I could figure it out. And so I'm interested in working on her shearing right to left externally of her sphenoid. So lie on your left side. So we want that right side up. Here we go. And now I want to find her temple here. And then I want to feel exactly the direction that it feels like the hardest infill is. And it's actually kind of going towards her eyeball a little bit there. So I am mobilizing in this direction. But just like with any joint mobilization, I want to feel on a clock which direction it feels the hardest. So again, I'm right there. Sometimes that'll reproduce into the eye. Mm-hmm. And I'm actually going to use my left hand to mobilize this. So I could have her, and I'm going to just see if I want to localize, yeah, that right there. So I'm actually rotating her head towards the right to further engage that infill. Now I could have her nod her chin down a little bit or nod it up a little bit. That's up, and up engages that infill immediately there. Breathe in and out. Good, and in and out. Good. And Sarah, I'm going to have you step back towards the lamp a little bit. Yep, right over there. All the way back towards that lamp so we can see her legs also. Yep. So then from here, sphenoid is a bone that there are direct dural attachments to it inside the cranium. And so from a nervous system tension standpoint, it's a really important bone to manage. Can be tied in with neural tension, can be tied in with headaches as well. And so I am very interested with the sphenoid in upper limb tension testing. And you could test with more of a radial nerve bias, with more of a median nerve bias, or with more of a ulnar nerve bias, right? And then those are, I am not being very specific with that, but in general, you could feel, if you bias through the arm, if anything brings more tension into that sphenoid. I could also have her do a little basically modified side lying slump test, right? To see if anything pulls there, and it actually does a little bit. And so my mobilization come off that just a little right there and then back on. So I could actually have her work throughout her whole system, basically from her cranium all the way down, because we know neurofascially there are connections all the way through the body, and she's just being the best patient ever by going to that infield and taking that last little bit of a pivot at the ankle there, which is dorsiflex and plantar flexing, pressure on, pressure off. Stop with that just for a second. You can take your knee back out. I just want to show one more option. I could also rotate her. Let's say that she does have a lot of neural tension, but is also not extremely sensitive to doing a lot. I could have her rotate her trunk back. Ooh, that's good. Or rotate it down towards the table. That softens it. So if she rotates back to there, now I could have her pump her ankle, and now we have an even greater infield there. Okay. So these are just options. That would be kind of like the final thing that I would progress into. If you go straight to that, it may be too aggressive, and their nervous system could be thrown off a little bit. Also of note, because of the proximity to the central nervous system and the attachments of the dura, anytime you're treating cranium, but especially sphenoid, you have to educate your client that they may feel like they just want to take a nap, feel a little out of it afterwards. You might even want to be like, okay, what's the rest of your day look like? Because if you have some really important meetings or really important time that you need to focus, it may not be the best day to work on sphenoid, because it can truly kind of mess with your nervous system. But then oftentimes when people come out of that kind of feeling of just like brain fog, woozy, tired, they can feel significantly better. So it's kind of like this education piece of, this is something that oftentimes people feel a little worse, but then within 24, 48 hours, they feel actually overall better. So just kind of keep that in mind with the education. So this is external sphenoid shear mobilization inside lying.